Abel was born weeks premature, had a bilateral split cleft palate and a quarter-size hole in the top of his mouth. He was able to eat and breathe and that sort of thing, but much beyond that, it was all going to have to be repaired.
My name is Abel, and I am a senior in high school. I have been a patient of Dr. Fashemo for around 11 years now. Dr. Fashemo, he'll tell you what he does, and then he'll do it. And sometimes it doesn't really make sense until it starts to unfold.
So Abel, the patient we're referring to, was born with a bilateral complete cleft lip and palate. So that basically means that when he was born, there were two gashes on his lip that connected and ran through his gum line, through the roof of his mouth, all the way back to his throat. So for patients like Abel, he would need multiple rounds of surgeries. The first one started for him when he was probably about age maybe 3 months, so the lip can be fixed. And then about 9 months to 12 months, his palate was fixed. And that usually restores some function, some semblance of normality so that the gashes are closed. However, for most of those patients like Abel, I met him when he was about age 6 years old. And around the age of 5 or 6 or 7, the next interventions from the dental or orthodontic treatment will begin. And that usually includes checking for his teeth and dental development.
The last few procedures were probably the toughest. He says he can do it, so I'm not the least bit concerned. The first few times he told me he could do things, I was a little skeptical, I'll be honest with you, and even talking to him, knowing he's a very smart guy, I didn't really understand how they could do that, but he did. It's a big load off me because it's a big load off of him. Dr. Fashemo especially and his staff, we couldn't have asked for better.